Hello. Falls are a major threat to the health and independence of older adults. More than 30% of people aged 65 and older who live in the community experience an unexpected fall each year. The incidence increases to 50% for those aged 80 and older. Falls can cause minor injuries, such as sprains and bruises, to moderate injuries, such as fractures, and even severe injuries, such as bleeding of the brain and head injuries. Falls are the leading cause of injury deaths amongst older adults. The good news is falls can be prevented, and fall prevention strategies can help reduce falls and fall-related injuries. One such strategy is to participate in walking programs and to perform exercises regularly. Evidence-based research has shown that individuals who perform a combination of weight-bearing, leg strengthening, and balance exercises, as advised by a healthcare professional, can significantly reduce their chances of falling. The following YouTube audio-video presentation will demonstrate simple, evidence-based balance and strengthening exercises. If performed on a regular basis, they can help prevent falls. The video outlines 10 easy-to-perform exercises that can be performed in your home while watching television or while doing dishes at your sink. There are a few things to remember before starting these exercises. Have a healthcare professional assess you physically and medically to make sure it's safe for you to perform these exercises. Make sure you're close to a sturdy surface, such as a heavy chair, a kitchen counter, a kitchen sink, or have another person provide you some support. Remember not to hold your breath during these exercises. Relax your shoulders down and roll them back. Also remember to keep your back straight. Start by doing 5 repetitions and add 1 to 2 every day until you reach 15 repetitions. You may choose to do 3 to 5 of these exercises one day, but make sure to do a different set of 3 to 5 exercises the next day. Here are the videos.
So this exercise you are going to come up to standing without using your arms. Try to do that 5 to 10 repetitions, control your sitting and try to get a sturdy chair. If you cannot do it without both arm support, you can use one arm to push you up and down. And if you cannot do it with one arm, you can try both arm pushing up and down and slowly progress to no arm support. You find a sturdy support in the kitchen or anywhere in the house or have a sturdy chair nearby, and then start this exercises by having your feet hip width apart. And now you're going to slowly lift your heels up, gently lower it down, control your lowering, lift your heels up, slowly lower it down, lift it up, slowly lower it, repeat it 5 to 10 times, lift it up, slowly lower it down, control your landings. You can decrease your arm support by holding on only with one arm if you want to challenge yourself. Once you're done 5 to 10 repetitions, stop, get your balance. Now you're going to lift your toes up and slowly lower your toes down. Toes up, slowly lower your toes down. Toes up. And if you want to challenge yourself, when you are lowering your toes, try to count 1, 2, 3 and then lower it. Try to count 1, 2, 3, then lower it. And then again, you can challenge this yourself by letting go of your arms, but make sure you are close to the sturdy surface. Okay, again, have a sturdy support ready to go in front of you. Have your legs hip width apart. Now try to balance yourself on your left leg and then slowly lift your right leg up as high as you can and down. Let's repeat that 5 times, as high as you can and down. Now here you are working your left leg by balancing on it, and your right leg is working against gravity. Now try to balance yourself on your right lower extremity, right leg. Lift your left leg up and down. Here your left leg is working to hold you straight. You can challenge yourself by letting go one hand. Now let's move on to different exercise. You are going to find a sturdy surface. Balance yourself first on both legs. Then now try to balance yourself on your left leg. Shift your weight to your left and lift your right leg up and down. Try that exercise for 5 to 10 repetitions, whatever works for you, while you're balancing your body on your left leg. and then you switch. Now you can balance your body on your right leg and lift your left leg up out on the side. Work on those outside muscles of the hip and down while your left leg is trying to work and balance you. Let's move on to this exercise. We are going to balance ourselves on both legs first. Now slowly shift your weight to your left leg. Try to balance and lift your right leg up and down. Now when you do this, try to keep your back straight. Your leg should go back from the hip, not from the back. Up and down from the hip. Up and down. Try not to jerk. Go up slowly. Lower yourself slowly. Go up slowly. Lower your leg slowly. Now stop. Balance on the right leg. Watch your posture and lift your left leg up and down. Try not to rotate your body. Try not to use your back to go back. Try to lift your leg up from the hip. Up and down. Up and down. You can repeat 5 to 10 repetitions. Now we are moving on to the mini squats. You make sure your body is straight, your back is straight. You're going to go down slowly and up. Keep your heels down on the floor, back straight and up. 3, 4, 5. You can challenge yourself by letting go one hand if you can. But as long as you have sturdy surface close by and you think you can challenge yourself. We are going to start challenging our balance now. Get into this stand-up position as you see this person. So stand with one foot in front of the other. Hold the support and see if you can hold this position for 30 seconds. Once you are able to hold this position for 30 seconds, you are ready for next step. Slowly lift your right leg up and try to balance yourself on the left leg. You're welcome to let go one hand and challenge yourself even further. Do this for 10 to 20 seconds and then go ahead and put the leg down. Now you are going to balance yourself. Now you are going to try to balance yourself on the right leg. Balance yourself on the right leg and lift your left leg up. Now you are going to hold this position for 10 to 20 seconds and challenge your balance. Once you are able to do that, you are welcome to let go one hand. You can gradually, every week, challenge yourself by letting go arm support. But hold this position for 10 to 20 seconds if possible. We are going to try to challenge ourselves by walking on one line. So first start with patient standing with his left foot in the back and right foot in front, right foot touching the toes of the right heel, touching the toes of the left leg. Now once you balance yourself in this position, now try to walk forward with your left foot on this black line. Now again with the right foot, right heel touching the left toes. Now left heel touching the right toes. Now you can keep on going and walk in left one lane. Make sure you're holding on to the sturdy surface. Stand close to the sturdy surface. So in case if you lose balance, you have the sturdy surface. Now you're going to stand straight with feet together. Now you're going to try to sway your body in a clockwise direction from left all the way around to the right. Left, front, right, all the way in the back. Try to bend from your hips, not from your neck, and go to your left. Keep swaying your body. Repeat this 3 to 5 times if you can, and then progress to 5 to 10 times. Every day you can add 2 repetitions. Stop these exercises if you get dizzy. This is a great challenge to your balance, but if you get dizzy, you got to stop exercise right away. Now, this is another balance exercises to challenge yourself. It's called figure 8 walking. You can use a marker to draw figure 8 on the floor, or you can use a tape. But before you do this exercise, I would highly recommend to talk to your healthcare professional or physical therapist to assess your balance to make sure you're able to challenge yourself by performing this exercise. This is called figure 8 walking. You can try to do that 3 to 5 times and then slowly progress 1 repetitions every day.
Well, those were the exercises. Remember to perform these exercises regularly. If you can't perform all the exercises in one day, you can do some exercises every single day to build strength and balance to reduce your risk of falls. You may progress the exercises by either adding repetitions or decreasing arm support, or adding ankle weights, or even by using TheraBand. Please remember to have your healthcare professional assess your strength and balance before starting on this exercise program. Also, please stop these exercises if you feel unusual pain or muscle soreness. Please also stop these exercises if you feel weak, dizzy, or experience any other new medical issues. Lastly, please contact your healthcare provider or physical therapist if needed. Thank you for watching.